You'll be talking about the application of PIC technology in biomedicine. If you apply this right, what could be the huge benefits of PICs?
One of the main benefits is going to be our ability to get more information from a biological sample quicker and cheaper than we can with current methods. You know, right now you'll give a blood sample if you go to your doctors, and that gets sent to a centralized lab. You'll get information back in a few days. With PIC sensing, I think we're going to see avenues to point-of-care diagnostics where the doctor tests you right there, has a tiny little machine that may even be the size of a cell phone, and immediately is able to provide information that lets him or her treat you much more effectively than would be otherwise possible. One of the things that I mentioned in my talk is, you know, we used to think the future was Spock's tricorder. Now, some of your younger viewers may not recognize that, but the series Star Trek, the original Star Trek, Spock had a tricorder that was like this big. And you know, what we want is something that's not that size. We want something cell phone sized that is going to be able to inform us about our health. And I think that's really where we're heading, which is in a way beyond what we even thought of in the past as science fiction.
I can imagine that if you make things smaller and easier to use, this could be beneficial for remote areas.
Absolutely.
Areas, right?
Yeah, that's an area that is really important to what my lab does. And in fact, I've sent students to Kenya to survey them about what kind of technology they would be interested in using and what their greatest needs are. But whether it's Kenya or, you know, rural US or anywhere that may have somewhat limited access to technology, I think PIC sensing is going to make that much more accessible and cost-effective for people in those environments.
As soon as you touch medication or medicine, that field, you get into the regulatory part of this.
That is an important challenge to be aware of, and I think for people involved in this area or anyone who wants to get involved in this area, it's really important to be doing development of these new technologies in concert with discussions with government agencies so that you don't develop yourself into a dead end, right? And in many cases, some of the things that we can do with PIC sensing, because they're not yet possible with traditional diagnostics, there aren't the regulatory pathways yet to make that easily accessible. So you have to develop those in parallel. If you get into how a lot of the regulation works, you start by establishing equivalence to something that's already out there. But if I have something that's detecting 5 things and there's nothing out there that's detecting 5 things, how do I do that? And so I think that's one of the challenges that we have to work through. I think that's something that we'll be able to overcome, and I think the benefits are going to be recognized by people in agencies like the FDA and other global agencies, and so it'll happen.
Could you give me an example of what would be a first form of diagnostics or sensing where PICs can be used?
Well,
what's the entry for the market?
Potentially a really simple one is we've all gotten much more familiar than we'd like to be with COVID-19 and immunity to COVID-19 and vaccination and disease and all of this and variants. One thing that I think a lot of people would like to have an idea of is, as new variants arise, are we still immune to them based on our vaccination history? That's something that PIC sensing can address very easily, very quickly profile whether the antibodies that you have in your blood are going to be also reactive against many other strains of SARS-CoV-2, the virus that causes COVID-19. And there are many similar kinds of things that one can think about for new strains of flu, new common cold viruses, and so on. In terms of the technology development timeframe there, I think one of the advantages of PIC sensing is because it is done using standard CMOS compatible processes. It's ready-made for manufacturability, and that's something that is a focus of the industry. So that piece of the thing can be accomplished very quickly. The regulatory piece, I don't know as well, but I would say certainly within a 3 to 5 year time frame, that's something that should be possible. And one of the really exciting new areas that I'm going to be talking about later in the symposium is new opportunities for PIC sensing, particularly in the context of integrating photonic sensors with tissue chips, or people may have heard of those being called organ on a chip.
Yeah.
It's where you're trying to mimic the human biological system, a particular organ system, in a tiny chip-based format. And what we can do with PIC sensors is pair those with this tissue on a chip and understand in real time what the tissue chip is doing. Now, Why is that important? Well, at least in the US, at the end of last year, Congress passed the FDA Modernization Act that says that now the FDA must accept tissue chip data in place of animal testing data in the development of new therapeutics. So we have a way now to completely test new drugs in a human relevant system, potentially instead of in animals, reading out what those systems are doing with PIC sensors. So that, I think, is going to be a very exciting area, and I'm eager to see where it leads.
Wow, okay, but that's news. So actually what you're saying is maybe in a few years' time you don't need animal testing anymore.
Well, I don't know that we'll ever be able to get completely away from animal testing, but we can certainly limit it, and we can also start to think about things like, let's say that hopefully not, but let's say you come in and you need some kind of medical care. What we can do is take a blood sample from you, turn that into pluripotent stem cells, so the cells from which all other cells grow, build one of these tissue mimics on chip, just based on you, and then test all the possible drugs that could be given to you as you're recovering from whatever the medical condition is. So we can actually make prescriptions that are tuned to you as a single individual, rather than based on drug trials that were done on some anonymous mix of people. That's further out there, but it is something that is going to happen. And I think PIC sensors are going to make that much more relevant and fast than we would have been able to do without PIC sensing.
And if you talk about platforms for these PICs, is it silicon photonics, is it indium phosphide, or?
So I think we're certainly focused on silicon nitride as the platform that we work on. I think there are many other opportunities in various platforms. One of the important things in the area is your ability to scale at low cost. So I think silicon and silicon nitride probably have a distinct advantage there, but there will be places for all of these other materials platforms as well.